Hello, Mr. Vietti-Gosa. My name's Alana Papenfuss, and I am a youth voter for the upcoming campaign that you'll be running in. And I wanted to address healthcare. I am aware that healthcare is a rather important topic for you. I especially see that after reading about your medical history that led into your teen years, and the healthcare that was provided due to your mother's occupancy. More specifically, I will be addressing the SB 562, also known as the Healthy California Act, which states that its main goal is to provide health care for all Californians, these including Medicare or Obamacare, Kaiser, and most importantly, I would like to discuss universal health care. After further research, I found out that there are 6 million Californians committed to guaranteeing health care within the state of California. The overall goal of the campaign is to improve Medicare. However, the Trump administration is making that goal almost impossible. Here's why. The ACA, or the Affordable Care Act, needs the Trump administration's fundings in order to move forward, but there is little to no chance of that ever happening, given that they have no intention of providing it. It is important that California move forward towards universal Medicare, but with no fundings and no real plan, the SB 562 will be nothing but ineffective. If California were to lose Obamacare, or the ACA, it would be disastrous. There are many reasons why it is so necessary. One being that if you already have health insurance under this act, you are not obligated to change it. Another positive would be that children under the age of 26 get to stay on their parents' health insurance. Also, with this act, fewer people said that they didn't have health care because of affordability. If Obamacare were to be eliminated, there would be more Californians without health care and more people who are forced to pay the tax penalty for being uninsured. Some of those who couldn't afford health care are now being forced to pay a tax that is increasing more and more each year.
You can get health insurance and choose not to, and you aren't exempt for any other reasons, you may have to pay a tax penalty. The tax penalty is calculated based on a percentage of your household income, or a per person or per family rate, whichever is higher. For the 2014 tax year, the tax penalty amount is either 1% of your household income or $95 per uninsured adult and $47.50 per uninsured child, up to $285 per family. In 2015, the amount increases to 2% of your household income or $325 per uninsured adult and $162.50 per uninsured child. In 2016, this amount increases again and adjusts for inflation every year after that. The penalty amount is also based on the number of months you or your dependents were uninsured. If you're uninsured for less than 3 consecutive months, you won't have to pay a penalty for that time period. This is called a short gap. If you have more than one short gap in coverage during the year, your penalty exemption only applies to the first gap. When you file your tax return for the year you were uninsured, your tax penalty will either be deducted from your refund or added to your tax bill. By law, the IRS may not use liens or levies to collect Affordable Care Act tax penalties, but they may take the penalty out of your expected tax refund.
After researching healthcare in California and looking more into the issues that you stand for in your campaign, I've developed a question that I wanted to ask you. What is the economic significance of universal health care from multiple standpoints? You said that your mother had health insurance, which covered your medical care as a teen. How is this going to affect those who have no health care versus those who have the best? Thank you.